we have 14 million plus girls who will almost never have to worry about getting infected with HPV or coming down with cervical cancer in their later stages in life.
At the end of our implementation, we vaccinated 14,854 zero-dose children, which is 27% of the estimated number of zero-dose children.
We always think about results. We always think about finding new ways to improve on existing processes.
What we've done is we've actually made a remarkable feat for the country, Nepal as a whole. This is the first time that their FPP is passing the no objection phase and has moved on to the IRC phase. So we're in the process of finalizing the FPP for Nepal, and come this December, the IRC will be sitting and to review and approve this FPP.
We are still routinizing right now, so we've moved from the normal campaign phase where we introduced, into a lot of girls in a very short time. Now we're getting the vaccine to be routinized, so we can get girls to by themselves go get vaccinated in these health facilities. And we've even created a lot of awareness at this point, where we even have older women going to get vaccinated in private facilities or secondary facilities with the vaccine. So that for me is the biggest success, the fact that we were able to overcome all the challenges that we encountered to get over 14 million girls, 14 million Nigerian girls across all the demographics. So this wasn't even just a thing of you vaccinated girls in the urban areas and then girls in hard-to-reach areas were left out. Both girls in hard-to-reach areas, girls in rural areas, security compromised, girls across all educational backgrounds, all social demographies have been reached with this vaccine, and that for me it makes me sleep well at night.
In the course of this implementation, we had a revolutionary tool that has not yet been done by any partner as far as zero-dose implementation is concerned. And this tool is called the Micro Coverage Tracking Tool. It's a digitized web-based tool that provides insights on the status of these zero-dose children before and after their vaccinations. So once these identified children are vaccinated, it changes the status of these children to vaccinated. So per time, you can track when a child is zero-dose, when they have become vaccinated to age, and when they have become fully vaccinated. So that's an innovative tool that has positioned Sydani as a thought leader in implementing zero-dose projects.
Now we know that human resource for health is very fluid. Even though the challenges that we face in the various countries are different, we still see similarities in different places. By using the data we gathered from this project, we're able to develop a sustainable human resource for health strategy in Nepal. This way, it ensures that GAVI's investment in Nepal is targeted, is also catalytic in the sense that the government is able to take over some of the obligations that we recommend for Nepal as a result of this model.
They're going to achieve especially coverage, right? So their immunization coverage would improve because this is an investment that GAVI is making for 5 years. And based on the interventions that were also proposed to be implemented for this number of years, we are certain that the immunization coverage of the country would certainly improve. And secondly, through the use of efficient use of vaccines, lives will be improved and there will be less outbreak of diseases in the country.
We have some beneficiaries from our project already. We have the pedagogy experts. In the future, during implementation next year, of course, these pre-service teachers are going to benefit from the project because we're building their capacity to be able to go into the world and be able to improve learning outcomes of pupils. So these pre-service teachers will benefit from the project. And then the plan is that in all colleges in Nigeria should actually benefit from this, our pilot project.
The testimony that actually got at the end of the program was that the cohorts that came from Adamawa, they actually appreciated the training so much that initially they plan to outsource an end-of-the-year project. It was like a customer survey project. So instead of outsourcing it, they just put their skills to work. The whole agency trusted them with, number one, coming up with the right and the most robust tool for the survey, as well as analyzing and reporting the findings from the survey.
We recently had the Africa HPV Forum in Addis Ababa, Ethiopia, funded by MSD, and they coincidentally were the manufacturers of the vaccine that we used for the HPV campaign. And it was a very, very insightful trip. We met people across multiple African countries. They came to also talk about how the HPV vaccine introduction was done in their various countries. We also got to share our own insights as to what worked well and what didn't work so well with introducing HPV vaccine. And we sort of put together a plan, a roadmap for other countries who are yet to introduce, and they can then use that to sort of structure how their own introduction would be like.
Human resource for health is a big challenge right now in Nigeria, especially in the last 5 years, with the high rate of attrition and the so-called JAPA syndrome. Now, one of the things that this model does for the country is that we have developed a model that can guide investment into the HRH space. Bill and Melinda Gates Foundation, we know that they have invested a lot of resources into the human resource for health through trainings, capacity building, and other types of interventions in the reproductive maternal health care in Nigeria. This model that we developed is a guide that will inform targeted investment across the subnational levels. In other words, if Bill and Melinda Gates Foundation wants to invest XYZ amount into Nigeria, they are better guided and better informed to know how to target these funds into the various states that meet the various needs.
Talking about impact and we visiting the northern states, this is like a step to building more impact for our clients or for our team. Of course, these are the things that are part of our 2025 strategy, and we are actually exploring more geographical locations. The first step was to cover the deep northern part of Nigeria, and our next step obviously will be moving to the southern part, or maybe the eastern part, where we even engage stakeholders the more, build solid partnerships so that we can always have it easy whenever we have events or any arrangement we want to make.
My project's name is Human Papillomavirus Vaccine Introduction in Nigeria. The main objective of the project was to significantly reduce the cervical cancer burden in Nigeria and obviously in Africa as a whole by the time we're done with Nigeria.
STRICAN project simply means strengthen routine immunization in consequential areas of Niger State. Or the overall goal of the project is to reduce the burden of zero dose by 25% in 4 prioritized LGAs of Niger State: Rafi, Kacha, Mariga, and Kontagora. What we had done there was to deploy targeted strategies based on geographical archetypes to reach the zero-dose children that have already been identified from our enumeration data.
The name of the project is Learning Agenda Towards HRH SBA Solution in Nigeria. The goal of the project was to identify challenges that affect healthcare workforce motivation, distribution, especially at the primary healthcare level. We had to conduct research, so qualitative and quantitative research into the HRH landscape, so to basically understand the situation of human resource for health in Nigeria. Now, one of the innovative things about this approach is that the team developed a HRH composite index model, which is the first of its kind in Nigeria, which basically looks at, it basically comes up with a maturity index for HRH in all the states. So we mapped out all the states across certain criteria, came up with their maturity, and based on these indices, we approached the states, coming up with a targeted model for each of these states, knowing fully well that HRH is different across the subnational levels. The HRH problem in Kano will be different from that in Lagos. This model, based on this innovative approach, was designed to meet the specific needs of the states.
The name of the program was Data Mastery Training. So basically, we're trying to bridge the gap in skills that exists in the data analytics market. First thing we did was to collaborate with people that have done something similar. Fortunately for us, in-house, we have the Sydani Fellowship Program. We're able to outline the people or the organization that we need to partner with, the right process that we need to put in place to ensure the success of the program, as well as the tools that we need to get ready and available.
My project is the Pre-Service Teachers Training Project. Our project has a scope of like 6 colleges of education across like 6 geopolitical zones in Nigeria, covering the south and the northern regions. So, first things first, we designed a module to fit into the pre-service teachers' curriculum as a whole. So this module comprises of the 4-in-1 teaching model. We conducted landscape assessment of the infrastructure, where we're able to assess the suitability and readiness of these colleges for our intervention. After that, we conducted KII interviews for the experts in these colleges of education and for experts in NCCE and any RDC. After training these pre-service teachers, we will send them to primary schools for their teaching practice, where they'll be sent to practicalize basically what they've been taught based on our 4-in-1 teaching model.
My project was the GAVI funded technical support to the government of Nepal on the full portfolio planning. So the objective was for we as the consultants to step in and support the country in developing their strategic narrative, theory of change, the work plan, and also their budget to align with the immunization needs of the country and also GAVI's objectives. We had our team members travel to Nepal at intervals to make sure that workshops are being held and meetings are happening. We also deployed the virtual approach, where we had virtual meetings with the country team and other country partners, that's WHO, UNICEF, to make sure everyone was on board.
So my project is the GAVI FPP for Sierra Leone. What this seeks to achieve is to enhance the impact and the efficiency of immunization program for the next 5 years for Sierra Leone, which is funded by GAVI. And this is particularly targeting zero-dose children in underserved areas. We made sure that we were abreast of very innovative things that are happening in the global health. We ensured that those are aligned with also GAVI's strategies for the coming years, and also ensured that they were within what the country had in mind to implement for this next 5 years. Sydani is a very forward-thinking organization. We pride ourselves in innovation. We do projects that outlive us.
We put in the work to ensure that across all the countries that we are currently present in, we are always putting our best foot forward to see how we can improve the health outcomes of the average individual on the street who cannot afford to take care of their health by themselves out of pocket.
It's not just about the output to us and just giving the funder what they wanted at that point. We also make sure that we have things that are impactful, and there's usually a sustainability plan and a sustainability roadmap to when we are not there anymore.
In addition to combining thought leadership, legacies, and innovation in the design and implementation of our interventions to achieve sustainable and impactful outcomes.
We are most grateful to our group managing partner, Mr. Sydani Sampson, for his guidance, ensuring that the team consistently redefined excellence.
It was great working with our stakeholders, the team within Sydani. It was an amazing work that we did.
So I'd like to thank the government for putting this whole thing together. The government was the driver of this success. So the Federal Ministry of Health, National Primary Healthcare Development Agency, and the state primary healthcare development agencies and boards across the 36+1 states. So I'd like to give a very big shout out and thanks to the other partners, the World Health Organization, UNICEF, other implementing partners that also supported this vaccine launch.
I'd also like to appreciate other project teams, such as we have the FPP Nepal, we have the FPP Sierra Leone, we have the STRICAN project, we have, permit me if I don't call your project, but everybody is recognized and appreciated. Thank you so much. It has really been a year. It has been tough, and at the same time, still worth it. The toughness made us stronger. So thank you so much, and look forward to doing more with you. Look forward to achieving more with you. Thank you.